This portion of Utah's Morning News brought to you by Regence, BlueCross, BlueShield.
Joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence, BlueCross, BlueShield of Utah. Always good to see you, Dr. Hiatt. I want to start with the American diet getting healthier. We even had an interesting news story this morning about if you could choose between being wealthy or healthy. More chose healthy, which I thought was a really good sign. Talk to us about the diet getting healthier.
You know, Amanda, it seems that the majority of Americans have chosen health over wealth. In fact, the American diet has been getting healthier over the past 13 years.
Wow.
There was a study that tracked what 34,000 American adults ate over the past 13 years. That's a lot of food studied. And what it found is that parts of the diet, of the American diet, improved over those 13 years.
So is it more vegetables, less meat? What is it?
Study participants reported, for example, Tim, that they ate more grains, nuts, seeds, and yogurt, and that they consumed fewer sodas, fewer sugary drinks, and less white potatoes and less refined grains.
That reminds me of something I'd seen about how water is now replacing soda, or we're drinking more water in general. So good news on that.
That is
front.
very good news. The bottom line, Amanda and Tim, is that although there have been some improvements in American eating habits over these past 13 years, there's still room for improvement. We can eat, in particular, more fruits and vegetables.
There's been a lot of stories lately about opiate abuse in our society, and you found some other complications from this, or at least the new studies show this.
Right. Tim, there's another study, a recently published study, which examined, coincidentally, that same 13-year period, and it found that people were dying not only from overdose related to taking these long-acting opioids for their pain, but they were also dying for cardiovascular causes, which means that you could die actually from heart-related disease if you take these opioid medications.
So the consistent use of opioids contributes to other problems in your health.
It does. And so the take-home message, Amanda, is that you really should avoid these long-acting opioids whenever possible. Particularly if you're at high risk for cardiovascular disease.
I saw a story a couple of weeks ago about the fact that if your doctor is giving you or subscribing to you opioids longer than a couple of weeks, you should ask to see another doctor. Do you feel that 2 weeks is sort of the limit here, or?
Well, it really depends on the person. In some cases, that may be needed, but really you should work with your doctor to see if there are alternatives to opioids, and if you have to take them, if that's the only option for effective pain relief, you should start with the lowest possible dose and increase that gradually.
Thank you, Doctor. This portion of Utah's Morning News brought to you by Regence, BlueCross, BlueShield.